So today's video is really focused on initiating core activation, core stabilization, core strength. So it's an excellent video today for any of my postpartum moms, but it really can be for absolutely anybody. I think it's us as women we think that we know how to engage our core, but many of us do not at all. While that's very significantly lost, typically following pregnancy, following delivery of a child, it really can be anybody, whether you've had a child or not. Learning how to turn on those abdominal muscles is critical for spinal health, for spinal support. And so this video basically really is focused on learning how to engage those core abdominals, as well as progressions into how to start strengthening those up at a very low level where many of us should start to be safe. Like I said, very important for any of my postpartum moms. We like to always wait, it's suggested to always wait 4 to 6 weeks until postpartum before we start doing any kind of really significant abdominal work, such as crunches and all of that, or sit-ups. But these are good exercises to start as soon as your doctor allows you to. So these are not going to be your sit-ups, your crunches, your really high level core exercises. These are basics, but absolutely foundational movements. So we're going to get started today laying on our back and just going to start on some breath work and some breathing techniques, okay? So if everyone will find me on your mat. So we're going to lay all the way down in whatever position's comfortable for you. When I'm on my back, I like to keep my knees bent, but it's not necessary. It's whatever feels good to your body. You may like everything extended out straight, whatever feels good to you in this position. So I like to start breath work with putting one hand up onto your upper chest and one hand down onto your belly. So we're going to start with chest breathing first. So as we inhale in through the nose, the hand that is over the chest, the upper hand, should rise up towards the ceiling. So as we inhale in, that hand should rise, and as we exhale out the mouth, that hand should lower back down. So let's work on that for about 5 breaths. I'm not going to speak through this a ton. I just want you to feel your body, okay? So hand on top of that chest as we inhale through the nose. It lifts up. As we exhale out, it goes right back down. Inhale through the nose. Exhale through the mouth. That bottom hand should not really be moving much at all. It's really just that top hand is what's going to be lifted as we breathe in. And one more here. So now we're going to move down towards belly breathing, or also called diaphragmatic breathing. So the diaphragm is a muscle in our core, in our trunk, that really is important with our respiration, breathing in and breathing out, and it moves up and down as we breathe in and we breathe out. So really working on belly breathing is what can truly help keep that diaphragm mobile and working well. So hand on top of the belly, we're going to move into diaphragmatic breathing. So as we breathe in through that nose, this time I want you to feel the air low down into your belly. It's your lowest area into your lungs. Okay, and that hand that's over the belly should rise. As you breathe out, it should fall back down. Let's do 4 or 5 here. Okay, breathing in through the nose, hand on the belly rises. As we breathe out through the mouth, it falls back down. That top hand is completely steady as we breathe in and as we breathe out. Last one for the belly breathing. Good. Let's move our hands to the sides of our body onto our rib cages. And so this is where we're going to do some kind of lateral breathing. So the last 2 we've done breathing where our chest is lifting up towards the ceiling and it drops back down towards the floor. This time we're going to change and try to get our ribs to expand, going east to west, out left to right, rather than up and down. Okay. So hands are on our rib cage, and as we breathe in, I want you to think about expanding those lungs out left to right into your hands. And as we breathe out, we should really pull those rib cage in towards the midline of your belly. Okay, so as we breathe out, everything expands out. As we breathe in,
or excuse me, as we breathe out now, everything comes back in towards the midline. So as we breathe in, everything pulls away, ribs expand out east to west. As we breathe out, everything comes back in tight, almost like I'm zipping you up with a corset. Give me one more good breath there. In through the nose and out through the mouth. All right, so we're going to change now. I'm going to sit up. You don't have to if you don't want to. I'm just using this for some education. We're going to go into moving with our pelvis, okay? So our pelvic region can often get really hypomobile or opposite, really hypermobile after pregnancy and after birthing a child. But really we need to get, it's not as much the mobility I'm working on whenever we do all this, it's more just the body connection, the brain to body connection is knowing that coordination of movement and being able to control it. So anyways, moving on. We're gonna go into a little bit of pelvic mobility. So if you will, you can do this laying down or sitting up like I am. It makes no difference to me. It's whatever feels good to you. I'm just using this so you can really see my body. Taking the palms of your hands, I want you to find your front hip bone. So this is called your ASIS. That's not important to you at all, but it's just the anatomical term for the front of the hip bone, the front of the iliac crest. So you're gonna have two really prominent bones right in the front of those hips there. Once you put the palm of your hands on those bones, fingertips, take them down towards your pubic bone. And that's that bone at the very bottom of your torso where those legs come to meet right there at the front, okay? Palms are on the ASIS or your front hip bones, fingertips are down towards your pubic bone, and the thumbs will then meet towards each other, pointing towards your midline. They're just slightly a few inches below your belly button, okay? So in that position, you can see that we have a pretty good little triangle going on there, and we consider that to be your pelvic triangle. So from here, I'm gonna go ahead and lay down. So after you get in your position, you've got all your landmarks, we're gonna lay down if you're not already. So in this position, I want you to kind of change gears, and we're gonna consider this triangle to be a clock, like a clock on the wall. Where your thumbs are up top is the 12 o'clock, the top of the clock. Down towards where your fingertips are is 6 o'clock on the clock. Where your left palm is 3 o'clock, and where your right palm is your 9 o'clock, okay? If I say that I want us to get into neutral pelvic position or neutral spine, if we're laying down and our knees are bent and we have our triangle form, all of our corners of our triangle, all three corners should be level. In this position, you should have just a slight room between your low back, a slight space between your low back and the mat. And that space is little, like the size of a marble or a blueberry, between your low back and the ground or the mat underneath you, okay? And that's neutral pelvic position. So everything's kind of in a neutral position. Now that might be a little bit different for everybody because some of us have bigger glutes or a flatter low back, whatever that may be, but that's kind of just the idea of finding that good positioning, okay? So from here, we're gonna start in that neutral position. All of our different landmarks are flat and parallel with one another. We have that small space in our low back. We're gonna go from this position, and we're gonna work on tilting of our pelvis down towards our 6 o'clock or where our pubic bone is. So we're gonna go ahead and go from neutral and tilt ourselves forward. Hold there. In this position, it should have increased the space between your low back and the mat, okay? Come back to neutral, and we should get back to that space where there's just a small space between the low back and the mat. So we're gonna practice from there. So from neutral, we're gonna tip forward towards our 6, as if we're trying to get our fingertips to go down in between our legs, and back to neutral. Give me 4 more here. Tilt towards 6, pull back to neutral. These are really slight movements. They're not really noticeable. They're very small. And let's do 2 more. Last one. Forward and back to neutral. Now we're gonna go opposite. We're gonna go up towards the 12 o'clock time, okay? So we're gonna imprint the spine this time. So hold once you feel like you've tilted to 12. You should feel there your low back has met either the mat or the ground, okay? Shouldn't be that small space there anymore. And now let's tilt back to neutral, okay? 4 more in this space. Tilted back towards 12, that low back imprints into the mat, right back up to neutral. Imprint the low back as we rotate the pelvis back into 12 o'clock, right back to neutral. Last one, all the way down. Good, and back to neutral. Now we're gonna change gears and start just like we did with that rib expansion when we were breathing. We're gonna go into the left and right planes of motion, okay? So from here, we are going to start in neutral and then tilt our pelvis over to our 3 o'clock, where our left palm is at, or our left ASIS. And then right back up towards neutral. Back over towards 3. Right back to neutral. Back over towards 3. Right back to neutral. Now let's switch gears and go over towards our 6. So we're gonna, or excuse me, our 9. We're dropping over towards the 9, towards our right palm, right ASIS, right back up to neutral. Over towards our right, back to neutral, and last one, over towards that right, back up to neutral. Good. Shake it out, kind of let everything rest for a second. You can rock those legs side to side and kind of reset a little bit. And then meet me right back in that neutral spine. So we're gonna add this all together a little bit, okay? So I want you to think about, you have a small marble in between your 2 thumbs, okay? And those are at your 12 o'clock, okay? Your marble's starting at 12, okay? Now I want you to lean over, tilt your pelvis towards 3, and take that marble over towards the 3 o'clock time. Tilt down towards 6, take it down to our 6 o'clock time, over towards 9, back up towards 12, where we should be imprinted into the mat. And again, over towards 3, down towards 6, our low back should be peeled off the mat, over towards 9, back towards 12, and let's turn, let's go opposite direction, over towards 9, down towards 6, the low back should lift off of the mat, over towards 3, imprint the spine, back to 12. Take that marble over towards 9, down to 6, over towards 3, up towards 12. Good, and then relax back into that good neutral position. All right, we're gonna add a little bit of breath work with this now. So as we tilt down towards 6, I want you to inhale through the nose. As we pull back towards 12, I want you to exhale out. So I like to think about, my stomach almost feels engaged when I'm, well it is. My stomach feels engaged when I imprint the spine in towards the mat. So I think about, I don't have room for air. I need to exhale it out. That's kind of how I remember the breathing pattern. So let's tilt back towards 6. Breathe in. Or back towards 12. Exhale out the mouth. Inhale towards 6. Exhale towards 12. Last one. Inhale towards 6. Exhale towards 12. Good, meet me back in that neutral spine. All right, last little bit to work on this pelvic mobility. We're gonna go into a bridging sequence. So I call these, everybody, Pilates-wise, calls these articulation bridges, okay? And what that means is we are gonna peel the spine up one segment at a time. Like we're taking each little bone in the spinal column and lifting them up one at a time, okay? But we also have a little pelvic movement that goes in with that. So start with me. This is gonna take a second for us to get, and that's completely fine. Start in that neutral pelvic position. From here, I want you to tilt the pelvis down towards 6, so we should inhale here. All the way back towards 12 as we exhale. As we get there, we're gonna start to peel the bottom up off the mat, lifting from our low back, one segment up at a time, until we get to the point where we're up at a good solid bridge position, okay? All the weight should be through your shoulder blades. It shouldn't be digging into your neck. If you go up too high, this lifts up too high, ribs flare, and all this pressure's on my neck, and this isn't what I want at all. So let's drop back down to a good flat spine. From here, I want you to start at the top of your spine and start to lower down one segment at a time. I really like to try to take these as slow as I can so I really get every bone. My back is super stiff, and so I have a hard time with these to make them really articulate. That's a good reason to work on it. All right, hands back on our pelvis. We're going to tilt down towards 6 as we inhale, back towards 12 as we exhale, and start to peel that spine up one segment at a time until we get up to our good bridge position, and then we start slowly lowering ourselves back down, starting at the top and slowly one segment at a time. We're dropping back down. Let's do one more so you get the hang of it, okay? Tilt towards 6, inhale, back towards 12, exhale through the mouth, and peel all the way back up. And we're lowering ourselves back down, starting at the top, lowering ourselves all the way back down. Good. All right, straighten those legs out. That's enough of all the pelvic work for right now. Let's work on a little bit of hip mobility. So with one leg extended out straight, I want you to take the other leg and pull it in towards your chest. And that's all we're really trying to do, is getting that knee or that thigh as close as you can to your chest without really pinching at the hip. If we're getting pinchy, let off a little bit, okay? Slowly let it right back out. Bring your other one towards you. And I have one hip that's a little bit more pinchy than others. This one doesn't love being really pulled into me. So it's normal if that happens. I wouldn't say it's normal, but it is what it is. Good. Right, back out. Let's do one more each side. Pull the leg in. Big inhales and exhales as we go through this. Good. And then right back out. Now what I want you to do is to pull that first leg towards you. Instead of pulling the knee straight towards the chest, I want you to pull it across your body. If you're using your left leg, you're pulling it towards your right shoulder. If you're pulling in on your right leg, it would go to your left. So it's just opposite knee to opposite shoulder. Really pulling across. And you should feel a big stretch in your glute muscles or in your booty. Good. Ease it back off. Switch to the other side. Pull that knee across the chest to the opposite shoulder. Push back out. Let's do one more each side. Pull the knee in. Pull the opposite shoulder. Right back out. And the last one on that leg. Good. Now from here, let's take both legs into us, okay? Pull them in nice and close and just kind of rock and side to side and let that low back kind of massage out. And extend them all the way back out. Now, slide one leg into you. I want you to take your opposite and cross the shin of that leg over on the thigh of your other. Okay, if you're getting a good stretch here, that's plenty. If you're not feeling anything, the next step, take your hands and press down into your knee and see if you feel any kind of stretch with that. Today, surprisingly, I don't. But if you do, stick with that. If you don't, the next step is to take your hands underneath that leg that's on the ground and pull that leg into you, okay? You can lift your head and chest if you want, but honestly, I would just keep it down for right now until we get the core warmed up. So you're gonna pull that in to really feel a stretch on the leg that's bent up to you, okay? If this causes you any discomfort or pain, do not do it, okay? Just work on a little bit of hip mobility. Ease back off. Let's just do the same thing one time on the other leg. So bend up the leg that wasn't just stretch, or was just stretch. Cross the opposite, and then you can start with pushing away if you don't feel any stretch there. Go ahead and put your hands behind that opposite thigh. Pull that leg up towards you. And I'm stiff as a board, so if you look like this, you're doing great, my eyes. Hopefully you're more flexible than me. Good. Ease back off. Last little mobility exercise I want to do until we get into some core stuff. I want you to meet me on your side, okay? from here, I want both arms straight out in front of you, okay? You're gonna take your top arm, you're gonna lift it up towards the ceiling, the head is following, and the chest is going to open up. The opposite arm stays down on the floor, and you're really trying to open up your chest, rotate the girls up to face the ceiling the best you can. Take a big inhale while you're here, and a big exhale out. Go ahead and close it back up. And let's do it again. So as we open the chest, let's really breathe in through our nose. As we close it back up, we can exhale out. One more, and then we're switching to the opposite side. Make sure those hips are facing forward as if you have two headlights on the front of them. They stay facing forward, although your mid-trunk is really rotating up towards the ceiling. So the girls face the ceiling, the front hip bones have the headlights facing forward. And rotate back, close. Then go ahead and rotate over towards your other side. I'm gonna turn myself around so I'm still facing you. All right. So legs are stacked, headlights facing forward, top arm opens up. Rotate yourself open, head can follow. The girls are rotating up towards the ceiling the best they can. Headlights are facing forward. Pull yourself back in. We got two more here. Breathe in as we open. Exhale as we close. Last one. Inhale as we open, headlights are staying forward, trunk is rotating up towards the ceiling. Pull back in. Perfect. All right, so go ahead and just take a little rest break for me. And we're gonna talk a little bit about core activation. So there's lots of different muscles that make up our core or our abdominals, okay? So we always think about our six pack, or those right up the center, and that's our rectus abdominis muscles. And those are very important muscles for the stability of the spine. And we always think about those because those are the ones that we see on people who are super toned up, okay? You also have your oblique muscles that kind of wrap around a little bit and provide that lateral and rotary support. But then our most truly, if we want to put them in order, our truly most important core or abdominal muscle is our transverse abdominis. And this is a muscle that is our deepest abdominal muscle. It wraps around us all the way like a corset, kind of zips us up. It is the muscle that truly provides the spine the most stability. When the transverse abdominis contracts, it actually creates like a traction force in the spine. It separates those segments a little bit so they're not just crushed on top of each other. So it can really feel good to a lot of people who have some issues with the spine or degenerative changes, arthritis, all that good stuff. But beyond the point, the transverse abdominals are our support system. They're our spinal support system, as well as really aid in pelvic floor health as well. They help with our pelvic floor muscles to provide strength and stability to them as well. They work hand in hand together. So the difficult part about that is that we've never thought of those muscles before, and we really don't know how to activate them super well. So I want you guys to go ahead and lay on your back, just how we have been. And I'm gonna sit up just so you can see where I'm picking and poking on me, okay? So if we lay down on our back, what I want you to do is to find those front hip muscles, those ASI, or hip bones, I'm sorry, those ASIs, whereas we had our palms at earlier, okay? From there, I want you to just scoop yourself in 1 to 2 inches and kind of dig in a little bit. Now don't be mean to yourself, but just kind of feel into that tissues. So from there, I want you to just cough, okay? Literally just a, and if you feel, when you do that, there should be some engagement underneath your fingers. So go ahead and try a couple more. You feel that something coming up and bulging your fingers out. That is your transverse abdominal muscle. So you kind of feel what that should feel like underneath your fingers if we were gonna activate them. So instead of coughing, now we're gonna try to activate them without coughing. So if you will, try to think about bringing your belly button down into your spine. So what some of my people will do is they'll literally just suck in. sure. They'll suck in when I say that. I don't want you to suck in, okay? So you're gonna kind of pull in, not by your breath, but from your abdominal muscles, from that transverse abdominis. So if you're doing that, so go ahead and relax for me. Find that bony landmarks again and slide in so you can feel it underneath your fingertips. So where we were when we coughed. Pull your spine into your belly button and see if you, or opposite, pull your belly button into your spine and see if you feel any engagement underneath your fingers, okay? And then relax back off. If you're having a hard time finding it there, you can also try if you go to your sternum, slide down your sternum all the way until you feel your ribs kind of start right underneath where your ribs are attached onto. In between there, you can kind of feel there too. So go ahead and do a cough there. You can feel them there, okay? So if we pull the belly button back in the spine, we can also feel, I feel mine better there than I even do. I do feel it down here, but really I can tell when I'm on by that one right there. Okay, so hopefully we're feeling what it feels like to engage those. Other kind of feedback or cues we can use is to think about as if we had a corset and we're really just pulling it all tighten up and we're drawing our rib cage in. So I like to think about my rib cage drawn in because that's really where the transverse abdominis runs. They run around us like that corset. So we pull the rib cage in. You can also feel it that way if that helps you thought-wise. Think about using your muscles to develop into a corset of really pulling the ribs in, okay, like Dolly, okay? So hopefully those have made a little bit of sense and we know how to activate those, because the next little bit we're gonna work on activating those and then adding steps to make it more difficult to maintain. So we're gonna start here in just a second. We're just laying down and just working on activation, release of that transverse abdominis. And then we're gonna add those following steps. I'm gonna go through quite a bit of a little progression with all of these, but kept it pretty simple and low intensity today. If when you are doing any of these exercises, you feel stress in your low back area, what that can tend to mean is a few things. Number one, check with yourself and see, am I engaged? Are my abdominals turned on, pulled in? Am I feeling that engagement in my core? If we're not, work on that, okay? Because that means basically you just don't even have them turned on. Two, if they're on and we're still feeling that, that means they're not strong enough for the load that we're asking them to do. So we need to take it back a step. So like I said, we're gonna go through a kind of progression today. If we get to any of these progressions and it's like, hey, I'm feeling this in my low back and not my abdominals, then we need to go back to whatever step that we were just doing, and you work on that until we're ready for whatever step I'm moving in. I'm giving you kind of a little bit of everything today, of very low level core stabilization exercises, but you find where you're at and we'll meet there, okay? So if we feel it in our low back, we're asking it to do too much and it's not ready for that step just yet. All right, I think that's where we need to start. So let's go lay on our back, okay? If you're not already there, lay on your back, knees are bent, and find whichever area you like. Do you like underneath that rib cage where it begins, or do you like kind of down towards those front hip bones? I'm gonna start my lower by the hip bones today, okay? So let's go ahead and try to pull the spine, the belly button into the spine, engage the core, and hold for me for 1, 2, 3, and relax back off. And again, engage. 1, 2, 3, and relax back off. What's important here that I think people do have a problem with, you can keep going, keep practicing while I talk, is I feel like when we tell you to engage your abdominals, a lot of the time they'll press their low back down into the mat, into that 12 o'clock tilt. I don't want that. You should be able to engage these transverse abdominis without changing the movement or the position of the pelvis. So if you are feeling yourself tilt back into 12, we gotta reel it back in, okay? So really maintaining that neutral spine, neutral pelvic position, and working on just engaging here. Another cue I can also use sometimes is especially anybody who's had siblings, is if, somebody's gonna come up and hit you in the belly, how would you really turn on those muscles so that it's not gonna hurt you? So that they hit you, it's like hitting the rock, We all have a little bit of the extra up top of that, but you get the point. So, fingers are there. I know I've talked a lot. Give me about 5 more good activations for 3-second hold. So we're activating for 5, 4, 3, 2, 1, and relax. I made you go 5 there, sorry. And again, 5, 4, 3, 2, 1, relax back off. 5, 4, 3, 2, 1, 2 more for me. 5, 4, 3, 2, 1, and last one. 5, 4, 3, 2, 1. Good. Next step that we're going to add on is a heel slide. So you should be able to do it on your mat, but for some reason it seems like a little sticky. You can always go somewhere where there's hardwood or somewhere you can kind of slide a little bit better. So what we're going to do is engage those transverse abdominis by pulling the belly button into the spine, engaging our core. Slide your right foot out slowly. This is a really slow movement. And slowly pull back in. The goal here is to not lose the abdominal engagement, although we're adding a limb movement. Let's switch over to your left, okay? Abdominals are engaged. We're sliding now for 3, 2, 1. Pull back in for 3, 2, 1. And right leg. If you need to take rest breaks on the engagement, like you need to reset each time, that's completely fine. But the goal is for you to eventually be able to hold that abdominal contraction while you continuously change from right to left. Good. Let's do 2 more each side. 3, 2, 1. Extend and pull back in for 3, 2, 1. Left leg. 3, 2, 1. Back in. 3, 2, 1. Last time each leg. 3, 2, 1. Extend. 3, 2, 1. Pull in. Opposite side. 3, 2, 1. Extend. 3, 2, 1. Pull in. And rest everything down. Alright, so from here we're going to add on a little bit extra step with that. Okay? So go ahead and pull those abdominals in. Engage the spine, or engage the abdominals. Slide this foot out, your right foot out, completely straight. I'm going to come up to sit up, and you guys stay laying down. So we're going to extend all the way out straight. Our toe is pointed up towards the ceiling. I want you to take that leg and rotate it out slightly from the hip joint. So not just that foot pointing out. Really rotate from up here out, where those toes are kind of pointed out towards the corner of the room. And then I want you to slide it back in, keeping this core engaged. 3, 2, 1. Pull back up to where it's in line straight. Okay? Slide back out. 3, 2, 1. Rotate the foot out and then slide it back in, dragging yourself in. And back up towards the center. Now this time I want you to go opposite. You're going to let that leg kind of fall out to the side just a couple inches. Slide the foot out so those toes are pointing out towards the corner of the room as the leg is extended. Pull it back in towards neutral, pointing up towards the ceiling, and then pull back into you. Let's do one more here. Knee slightly goes out to the side, slide all the way out. Toe points up towards the ceiling as it rotates back in, pull all the way in. I'm gonna lay all the way back down now and do this other leg with you all. So reset yourself if you need to. Engage our core muscles, our transverse abdominis. Slide that leg all the way out. Toes are pointed up towards the ceiling. Gently rotate it out just about 30, 40 degrees. Pull yourself back in with the toes facing out towards the opposite corner of the room. Pull back in up towards neutral. One more. Slide all the way out. Rotate out towards the corner of the room. Slide all the way back in. Pull back in. Now, gently let the knee fall out to the side just a couple inches. Slide all the way out where that toe is back at that position out towards the corner of the room. Bring it back up pointing towards straight up at the ceiling. Slide back in. All right, out a little bit with the knee fall out. Slide all the way out. Point up towards the ceiling. Slide yourself all the way back in. Good, go ahead and just let those legs rock side to side. Hope we're still doing pretty well with everything right now. If we're getting to the point where anything's straining in the low back, reel her back in, go back to just the transverse abdominis contractions without movement, or just with the heel slides. All right, so from here, now we're gonna go back, we're gonna add on. So engage the core, pull in the belly button to spine, transverse abdominis to turn on. I want you to take your right leg and just lift it up into a march. Slowly drop it right back down. Switch to your left side. Slow lift up, 3, 2, 1. Slow lift right back down. 3, 2, 1. Switch. 3, 2, 1, and back down. 3, 2, 1. Lift. Drop back down slowly. One more each side. 3, 2, 1. Drop her back down. Last one on your left side. Everything should remain engaged. Drop back down. Ease everything back off. Perfect. Next step with that one, I want you to lift. So engage here first to protect that low back. Lift one leg up into that march. Bring your other leg up to meet it. So we call this tabletop, where the hip is flexed at 90 degrees, the knees are flexed to 90 degrees, okay? And then I want you to just go back, drop that right leg down first that you brought up first, and then drop your left leg. Switch me over, let's do your left leg lifts first. This is all engaged to protect. Lift that right leg up. Neutral with the pelvis, we shouldn't be here, rocked. There should still be a very small space in that low back, okay? And then drop that left leg down. Drop your right leg down. Let's do one more each leg. Right leg lifts up. Left leg lifts up to meet it in tabletop. Drop that right leg down slow. Drop your left leg down slow. Last one, the left leg lifts up into the march. Right leg lifts up to meet it for tabletop. Left leg drops down. Right leg drops down. Perfect. Let those legs just go side to side. And like I said, if we get to any point where I'm going further than where you are right now or where you should be, if we're feeling in that low back, if we're having any discomfort anywhere, you need to stop and go back to the step that was doable to do, okay? All right, so from here, we're gonna try to lift right leg up, left leg up to meet it, and we're gonna hold this position. From here, we're gonna slowly, toes are pointed away, drop our right toe down, tap the ground, lift it right back up. Left leg, toe drops down to the ground, we pull right back up. Abdominals are engaged, low back is in that neutral spine position where we're not imprinted, but we're also not arched up. That's where that pain will come in. Keep the core engaged to keep you in the neutral position. As you slowly, and the key is slow, we can do things fast, but we're trying to get that brain to body connection. Let your body feel what your abdominals feel like. Because for some of us, after C-sections, after even vaginal births, anything with this trauma to our abdominals and trauma to our deep pelvic floor, we have a hard time feeling that. So one more on that left side, pull back up and then drop one foot at a time down. Here we go, to the ground. Let those legs fall side to side. All right, next on our progression list, make sure I'm not missing any. I wanted to go over. Good. Last one I want to try today is to lift both legs up at the same time. So they're both going to lift up into tabletop, and we're going to hold for 5, 4, 3, 2, 1. Drop both toes down. Now this one's pretty intense, okay? So if this is hurting the low back at all, we probably just need to go back to just the toe taps, alternating back and forth, okay? So just feel your body and don't push yourself or we start creating problems that aren't there. Okay. 5, 4, 3, 2, 1. Drop the toes down. Lift back up. 3, 2, 1. Drop down. This is our last one. Lift back up for 5, 4, 3, 2, 1. Drop them all down. Let those legs go side to side. Good. Now the next thing I want to work on while we're laying down, and then we're finishing up with just some pelvic movements, is we always hear the term about Kegels, okay, and starting to work on our pelvic floor muscles. So if I turn and we think about our pelvic floor, just to be pretty blunt about all of this, we think of we did our triangle here, okay? We're gonna do our diamond when we think about down there, okay? Can't really make that. But that is the position when we think about the bones. If we looked at the pelvic diamond down there, we have a diamond that forms that area, okay? So there's lots of different ways to think about engaging those muscles. I've read some stuff that says, and let me preface with saying I am not a pelvic floor physical therapist. I'm a general physical therapist and have education on this, but I'm not a specialist in this area, so take that as you will. But different kind of cues to help you realize if you're activating those muscles or are you not, okay? So one way to think about it is, and this is not something you want to practice often at all, literally not at all, but you can do it once to get the feeling. If you are urinating and you try to squeeze to stop the flow of the urine, that is what, those are your pelvic floor muscles that are doing the work to stop that urine. So that can kind of help you feel, or at least get an idea of what those muscles feel like when they contract, okay? So there's a few different ways to think about it. I like to use the concept of a jellyfish, okay? And when we think of a jellyfish as it is going through the water, it pulls in and it releases, and it pulls in and it releases, okay? And that's what we're gonna start today with, just feeling that pull in and the release. So if you guys wanna go ahead and lay back down on your backs, what we're gonna start with is just that upward feeling. So think about where my hand is as being our jellyfish. As we pull in, we're pulling down, pulling up with those pelvic floor muscles, and then we're releasing back off. Okay, we pull in with those pelvic floor muscles, and then we release back off. We could add in our breath work as we pull in, we breathe in, as we exhale, we release everything, relax it back off, okay? So let's go ahead and pull up the best you feel like you can. When you do that, I really want your booty muscles to stay relaxed. I have a hard time with this. Sometimes they automatically like kick in like they're helping. They don't need help, okay? So try to make sure your glute muscles are staying pretty quiet, is what I like to say with it. So if we have our jellyfish here, we're gonna pull in and up with our pelvic floor muscles. Hold for 5, 4, 3, 2, 1, and then release yourself back off. Pull up, 5, 4, 3, 2, 1, release back off. Let's do 3 more here. Pull up for 5, 4, 3, 2, 1, release back off. Then 2 more. Pull up for 5, 4, 3, 2, 1, release back out. Last one. Check in with yourself as you're doing these. Be sure the glutes are quiet. We're pulling up with those muscles, and then we're releasing back off. Good, and relax. So I want you to work on that for sure daily, throughout the day. You can do them when you're sitting at a stoplight, you can do them when you're sitting there holding the baby, when you're doing breastfeeding, whatever it may be, whatever works for you, doing that multiple times throughout the day. The goal is to eventually be able to hold 10-second hold for 10 reps, and doing that anywhere from 3 to 4 times a day. For right now, let's start with 5-second holds. If that is super easy for you and that's like, no, it's no big deal for me, push your way on up to that 10 seconds. No need to go any longer than that. So 10-second holds for 10 repetitions, 3 to 4 times a day. All right, so the last thing I want to do today is to get on to our hands and knees, and we're going to work on a little bit of those pelvic movements. I think the mat always helps me when I'm doing these because I can feel, okay, my space is increasing, my space between my low back and the mat is decreasing. So from here, this is going to be a little harder for us. Think about, we still have our pelvic clock here. We're starting in neutral where everything is flat, okay? Our abdominals are engaged, transverse abdominals are sucked in, okay? And we're gonna tilt ourselves towards the 6. So with that, your low back should drop a little bit towards the mat this direction, okay? And then we're gonna pull up towards our 12. This is a really small movement because I want it coming from basically the low back to the pelvis, just this small region. None of this I want right now. This isn't a cat or a cow. It is a pelvic tilt. Towards 6, towards 12. Towards 6, towards 12. Let's add a few breaths in with it. We'll do child's pose and we'll be done today. So towards 6, we're breathing in. Towards 12, we're breathing out. 6, we're breathing in. 12, we're breathing out. 6, we're breathing in. 12, we're breathing out. Good. Meet me in that neutral spine. Drop yourself back to child's pose. Reach those hands long out in front of you. Feel the good stretch in your lat muscles if they're tight, which mine are big today. Drop your booty down towards your heels. Big breaths in through the nose and out through the mouth. Give me 2 more good breaths. Good, and then roll yourself all the way back up. Great job. I hope that was a good starting point. I know that was probably information overload, but I hope it is a good starting point for us to progress from here, for you to start feeling things, and then we'll build the strength once the connection's made.